Have you ever walked in a room and felt like everyone was judging you? For millions of people, that fear isn't just in their head, it's social anxiety, and it affects about 7% of the population every year. It's more than shyness, it's a persistent, overwhelming fear of being watched, criticized, or embarrassed in everyday situations. People with social anxiety may worry for hours before a conversation, avoid speaking up in front of class, or feel physical symptoms like shaking, sweating, or racing heart. It often begins in teenage years and can be shaped by genetics, stressful situations, or growing up in environments where mistakes are criticized very harshly. But here is a very important part. Social anxiety is treatable. Many people may not think so, but it is. And new research is making treatment even more accessible. In the article I reviewed, published in 2025, researchers tested a new form of therapy using virtual reality. Participants put on a VR headset and practiced real social situations, things like public speaking or group interaction, in a controlled, safe environment. The study found that virtual reality exposure significantly reduced social anxiety, depression, general anxiety, and stress immediately after treatment. People felt more confident and less overwhelmed. Even participants diagnosed with social anxiety disorder showed meaningful improvement, although some of the symptoms returned 2 weeks later, suggesting that follow-up care is very, very important. What this tells you is technology is very powerful and can make treatment easier, more comfortable, and more engaging for people who struggle with social anxiety. More importantly, it shows that social anxiety people are stuck with for the rest of their lives. Real progress is possible. So why should we care? Because social anxiety is one of the most misunderstood mental health conditions. People often assume anyone with social anxiety is rude, uninterested, or avoiding other people on purpose. But in reality, they're fighting an invisible battle most of us never notice. If we want to reduce the stigma, it starts with understanding. Be patient with people who seem quiet, and don't label someone as antisocial when they are already terrified on the inside. And if you struggle with social anxiety yourself, remember this: treatment works. You are not alone, and reaching out is a sign of strength, not weakness. Thank you, everyone.